For the past 24 years, Rocky has been a gentle presence in the barn for Judy Owens.
Okay, Rock.
But saddling up her beloved horse became much more difficult as Judy approached her 80th birthday.
Everything was bad. I could barely lift the saddle on.
Once a competitive rider, Judy could barely reach or lift her right arm. X-rays showed that she had osteoarthritis, and over time, the cartilage that cushioned her shoulder joint had worn down.
Once it's limiting activity and affecting decisions a patient makes on a daily basis, avoiding certain activities because of shoulder pain or loss of motion, then that's when we can really help.
Dr. Matthew Smith is an orthopedic surgeon at University of Missouri Healthcare. He says for patients like Judy who don't find relief from medication or injections, shoulder replacement can be a good option. It's a surgery he performs about 250 times a year.
We cut off the arthritic ball, and there's a little metal ball that attaches to a stem in the arm. And then the socket gets resurfaced with a plastic socket.
About 6 weeks after surgery, Judy was back on her horse. When osteoarthritis began to take a toll on her left shoulder, she had that joint replaced too. And today she's riding Rocky without limits.
But anybody that says they have, their shoulders bothering, I say, go see Dr. Smith.
But he's good. He'd stand like a rock.
And caring for her favorite companion without pain. From the University of Missouri, I'm Teresa Snow.
You have to tranquilize